Hey guys, it's Ted Bogert. Welcome back to one of my favorite series on the TED Show. It's Advance Preventive Medicine, plus, all the amazing things with the one and only Dr. Saied is here today with Advanced Preventive Medicine and Urgent Care. It's a facility that he owns here in Orlando, and he's on the cutting edge of all things preventative and helping you feel better. And welcome back, my friend. How are you today?
Hi, how are you, Ted?
I'm doing great. I'm excited to be back. We have topics all set up for the next month. And this week, we're going to talk about comprehensive preventative care. But before we do, let's reintroduce you to the audience. Tell them a little bit about you and your practice.
Sure, I'm the medical director for Advanced Preventive Medicine. We are located in downtown Orlando, basically on Robinson, very close to Lake Eola. And this is a solo private practice, and we, started this with the fact that we picked the name of Advanced Preventive. As you see, there is no endocrine, cardiology, infectology, GI, or anything else linked to this. And all you hear in medicine is always all this specialty, and nobody, I would say, care about preventive. Preventative care to me is the most important aspect in medicine because if we care about prevention, we would never deal with the disease and treatment down the road. Or I wouldn't say never because God forbid there are cancers, there are, incidentals, there are genetics things are involved, we have genes leading up to cardiovascular conditions. So basically, we are at need of cardiologists, dear endocrine doctor, dear gastrointestinal doctors. But there is a big deal with prevention. So if we prevent root cause of the conditions, probably we are having longevity in life. We have the fact that we do not get old, in a rapid mode. And I would say our organs will last longer with better quality. Examples are the biggest thing in the world. What do we have the most common conditions? Diabetes, hypertension,
Yeah.
hyperlipidemia, high cholesterol, right? All they are preventative. All they are in the preventative care that these things, they're the one that you end up to cardiovascular, cerebrovascular accident, etc., etc. So the big deal in medicine to me is prevention. And that's why we are dealing with metabolic syndrome. Everybody is dealing with metabolic syndrome. What is metabolic syndrome, Ted? A
I
combination.
I can't wait. People talk about this all the time, Sam. So give him the 411 on that.
Exactly. So metabolic syndrome is the problem of almost everybody in the world. We are talking about diabetes, hypertension, high cholesterol, uh, endocrine problem, and we are dealing with sluggish metabolism, obesity. Just these few words. How many percentage of the population of our country here is dealing with these five words?
Right.
You see? So that is called comprehensive prevention, a comprehensive preventative care, comprehensive preventative medicine. And that's what we are.
And I love it. And I want you all to check the website scrolling across the bottom there. Check out Sam. There's each week we're going to talk about a different topic, but this is kind of the overview. I think a lot of people, they know that their body, they can't seem to be, they're on every single diet known to man. They've tried every single one, cabbage soup. I mean, the old days of keto this or whatever. And I think people are still struggling to lose weight, but it's a whole picture that you have to kind of put into play, right? I mean, it's not, you can't reverse, let's say, 40 years of bad habits
Exactly.
in a day. You have to work at it, but you take people in and you really examine them and examine what's going on and come up with a care plan, right?
Yeah. The problem is that is the shameful conversation sometimes we get with the patients. And I can give you an example. Somebody moved nearby and cannot go to the med spa that she was attending before because they were receiving weight loss medication like Wegovy and Ozempic and stuff like that. When we talked about this, what did I tell you? Not necessarily that I have to prescribe you Wegovy or Ozempic. I need to see how your metabolism is working.
Correct.
Hormones are important. Hormones, they're entitled with thyroid, testosterone, female hormone. This is a big factory. Just imagine, I always say, when you deal with your body, think that you are dealing with Boeing company, Airbus company.
Yes.
447 with 600 passenger goes from here to Hong Kong 18 hours. God forbid, if there is a glitch, it falls apart. The body thing all works together. All cells works together. There is no way you deal with obesity without looking at endocrine. And there is no way you only deal with thyroid without looking at your testosterone. So it's all working together. And that's the lack of knowledge for a lot of providers. So this lady, 43-year-old Michelle, is coming to me. I changed my med spa and I'm coming to you. I want to get my refill. Well, what did you get? Or Ozempic, or tirzepatide, Zepbound, Wegovy. Fine. But before we go further, I need to do a blood work. Well, I was very happy with this and I was getting this, but I didn't lose weight, but it's better because at least I don't gain weight. So I want to continue. So I convinced her to do blood work. Guess what? The blood work came with hypothyroidism.
Oh.
So her problem was not even the gaining weight, just obesity, hypothyroidism. And nobody checked because these med spas, all they care is prescribing you.
Correct.
Right? But to me, medicine is a big deal, like a big factory. As I said, 747 Boeing factory. Think that way. If I don't make sure everything is working fine and I start treating you for just Ozempic, that is not going to work. So
sure, you're just putting a Band-Aid on it. You're not even addressing the base issues, the core issues. I think that's what a lot of people don't understand. It's funny, in between when we have filmed, I had somebody ask a question and they made an observation, and I want to throw it at you because I think a lot of people wonder this. They want to know, does it feel like in the last, let's say, 20 to 25 years, there's been a spike in this kind of slower metabolism? Did the people of the 50s, even though they smoked, were they healthier? People have this perception that all of this stuff has just happened recently. And I wondered what your thoughts are on that. Is a buildup from our parents? Is it because we're eating a whole bunch of processed foods? All of that, is that really what's going on? Is it we're in a different era than people were back in the early days?
Yeah, that's a very beautiful subject to talk. Let me tell you something. When I was in medical school 25 years, before, when they were teaching us pathology and they were telling us, okay, we don't see much of sarcoma around. We don't want to burn your brain to study 450 pages of Robbins pathology about sarcoma. We created this little pamphlet, which is only 15 pages. Read this, and you're good to go for sarcoma, because that's not something we see. But look at the sarcoma today. Why we have so many cases of sarcoma?
Yes.
As you said, the big answer is we don't know. It's unknown. Is it genetic? Is it flare-up? Is it environment? Is it food? Environmental? Radiation? Cell phone? iPad? We don't know, but it's real. It's real that the transition of pathology and diseases are different from 20 years ago,
Yeah.
30 years ago. So metabolic syndrome is a big phenomenon now. But if you want my personal opinion, it has to do with environment. It has to do with the stressful life. It has to do with eating. It has to do what we put in your mouth. You know, look at my grandfather, 120 years. My grandfather, 99. The other side, 98. And
Wow.
they never went to a doctor. They never checked blood work. But they didn't have cell phone.
Yeah.
Didn't have electricity. They
Yep.
were in a very, very calm environment, eating well, all organic. There was no pesticide. There was no chemical. Everything they were possibly picking up from their backyard, their vegetable, their fruits from their yard. And look at the lifestyle there. Look at the lifespan back there. But nowadays, I had a case the other day, they consulted with me, 21-year-old female, wonderful athletics, end up with pain in the back and now has a big aggressive sarcoma that she's going to die in a month or so.
Wow.
I mean, you get goosebumps when I say these things.
Yeah.
Because the trend of disease and pathology is different, you know? And now you want to eat something? Read the back of, the food, the labels, ingredients. You don't know what we are dealing with today.
We should teach about that, because I have people say, well, I eat from the healthy aisle at, let's say, Publix. And I'm like, I understand that, but are you actually, things can be labeled organic that aren't necessarily good for you. It's really a bunch of marketing. So you have to be your best advocate, but people can come to you. Let's talk a little bit about the process. They can go online and fill out a form, right? Tell them a little bit about what to expect, because I want them to go to your website and get in touch with you.
I am extremely pleased and happy that I am working with a very prestigious IT company, that the owner is one of the well-known IT engineer in the United States. That's why he's very, very careful with our website. Our website is well designed, as you saw, and well put together. So I really recommend everybody to go to the website, check the list of services we do, apmuc.com. Under services, we have the list of different varieties of services we offer, but also we have checklists, we have scorecard. I recommend patients, they go there, automatically they can fill in a scorecard. Scorecards come directly to my personal cell phone, so there is no middleman involved. Filling out the scorecard is completely free, and I am committed to evaluate it and call the patient and evaluate that scorecard for free, without any charge, without any cash involved, without any insurance, I guarantee. And then we will talk to them and we will give our sincere opinion about preventative care, about their life and health, and how to guide them for the next 10 years. This is my commitment to my community.
And you do a phenomenal job, Sam. I mean, one of the things that I love about you, there's many, but there's no shame, right? I think a lot of people are fearful. They know that they've maybe not had the best habits, or they know that they've tried everything, and then they go into a lot of practices. I've experienced it where you get shamed by the medical professional. You leave there feeling worse than you did before you went in. And so what I love about you is that you're not like that at all. You want to find the solution. You're not here to blame anybody or shame anybody.
No, we are here to help. That's all I want to say to the patients. We have the tools for you. I have everything next to each other. I put the package together, walk you through the minimal encounter, the minimal torture, the minimal time to be wasted for both parties. Go to our website, file and fill out the scorecard, read the items, fill it out. It comes to me. It doesn't matter you have insurance, you don't have insurance. We are here for you, give you a sincere opinion about what will happen in the next 10 years in your life and what is the message, how to prevent what we think would be a danger for you, and write the plan and work together, go through the journey of living healthier and the longevity journey together, and walk you through the way of eating, the way to treat the condition if there is any, what's the best medication, what is the side effect, what is best versus the other, and giving you the options, different route to choose, why we have to choose pellet versus injections, and so many other things. The only thing is, as we talk today, and the topic of today's comprehensive prevention is not to deal with one component or one organ in the body. Yes. What I think as a provider, I think about endocrine, gastrointestinal, bone health, metabolism, cardiovascular, cerebrovascular, all the cerebrovascular symptoms at one shot under one roof. We don't say, okay, let's deal with your weight, forget about endocrine. That is the message that we take home today.
And that's what the comprehensive is all about. And I want you all to check out the website, apmuc.com. Go fill out the form, look at the services. Each week, we're going to talk about a different topic within the comprehensive preventative medicine world. And Sam is going to give us his knowledge and expertise. But in the meantime, I really, really do want to encourage you to go fill out the form, get the free consult. Sam is just as wonderful in person. His bedside manner is 100 out of 100. And I know that you're going to feel better once you talk to him. All right, Sam, you're amazing. Dr. Saied, thank you so much. Thanks to you and your team. Comprehensive Preventative Care. Check them out, apmuc.com, and then tune in to our show each week where we have a new topic. All right, my friend, thank you so much.
See you. I'm very pleased to serve everybody in the community, and we wait for them.
Awesome. Thank you, guys.